Martin, you recently gave a talk on itching, on pruritus. What are the main things that the key messages from that talk?
The main messages about pruritus itch are that pruritus is the most frequent symptom in which dermatologists see among patients. So it's a very important symptom which physicians, family physician and dermatology have to deal with, and to recognize as a physician that we have, on the one hand, very frequent symptom, very frequent diseases, on the other hand, very poor understanding about the pathophysiology, about the diagnostic tools, about the therapeutic algorithms, and that to understand the disease is very important for physicians to deal with each patient on a daily basis. Then we had made substantial progress in the last 10 years of understanding the pathophysiology of itch compared to pain, probably 30, 40 years ahead. And this has led to significant progress of identifying new therapeutic targets. And these can explain why histamine is not the only pathway of pruritus, why antihistamines don't work in several subtypes of itch, and that cytokines, proteases, neuropeptides are very important mediators in peripheral itch and also in central itch, and that peripheral and central itch has to be differentiated also with respect to future therapies, and that it's exciting now to live in this time as a dermatologist, because we probably will have in the next 5-10 years several new therapeutics that substantially will help itch patients to treat this debilitating symptom.
What are the targets for new therapies? Well, these, you said, peripheral and central. Tell us more about that.
So there are several new itch receptors which have been identified on peripheral sensory nerve endings, which are cytokine receptors like IL-4 receptor, IL-13 receptor, IL-31 receptor, TSLP receptor, and proteases like the PAR2, PAR4 receptor, neuropeptide receptors, even toll-like receptors. So there is a huge amount of new receptors plus ion channels. And the next substantial question will be, which of these receptors is dysregulated in which disease? Because it can be that in atopic dermatitis that it's different from CTCL, different from lichen planus, different from other inflammatory pruritic diseases. And that will be a very important future task to deal with. On the central level, there are several neuropeptide receptors and neuropeptides identified, which could be also targets for future therapy, like brain-derived natriuretic peptide, gastrin-releasing peptides, somatostatin, dynorphin, like opioids. And again, also in this, it's in the human system, it's very poorly understood in which diseases they are dysregulated.
Thank you very much for that summary. Let's thank you for the work that you personally have done in pushing, making progress and pushing the field forward. We certainly look forward, and there's a huge need from the patient point of view for new therapies. So thank you.
Thank you very much. Great pleasure.